my name is Allison Sadowski and this is my health teaching plan. According to the U.S. Department of Health and Human Services in 2014, heart disease is the leading cause of death in the United States. I selected a patient with a new diagnosis of congestive heart failure as there are many lifestyle modifications these patients can take to increase their health while managing their disease. My patient was a 53-year-old male with a new diagnosis of congestive heart failure. He came into the ED with increased shortness of breath over the past week and 3 to 4 plus pitting edema. His chest x-ray showed cardiomegaly and vascular congestion. His proBNP was 4,528. His echocardiogram showed an ejection fraction of 15% with diastolic dysfunction. His CBC was normal. His troponin was negative. His home medication list was empty and he had never been seen in the clinic previously. He is often on the road as he has been a trucker for many years. His case was going to be challenging as I know that his current lifestyle does not include activity, a low sodium diet. He is a smoker and he does not have any insurance. Lifestyle modifications are going to be important for this patient, and so I initiated a health teaching plan for him in hopes that even a few changes in his life would occur. 2 of the Healthy People 2020 leading health indicators were addressed for my patient. First, tobacco cessation. According to the U.S. Department of Health and Human Services in 2014, tobacco use is the single most preventable cause of disease, disability, and death in the United States. Yet more deaths are caused each year by tobacco use than by all deaths from HIV, illegal drug use, alcohol use, motor vehicle injuries, suicides, and murders combined. My patient has been smoking for over 30 years, and so this may be a challenge, but one worth taking. Nutrition, physical activity, and obesity was the second leading health indicator addressed. According to the U.S. Department of Health and Human Services in 2014, a healthy diet, regular exercise, and maintaining a healthy weight are also paramount in managing health conditions. I set one broad outcome for my patient, which was the patient will state at least 3 lifestyle modifications he should focus on for optimal future outcomes. Now to the education. I first provided my patient with a Living Well with Heart Failure booklet from Sanford in 2012. I then reviewed the normal functions of the heart and the normal blood flow of the heart, and then provided him with these pictures of the enlarged ventricles as well as the stiffened ventricles, and that this causes so that the heart does not beat enough blood out of the heart with each beat, which again causes heart failure. I also reviewed many other terminologies that are listed in this booklet and answered any questions he might have. And then I provided him with a daily treatment plan for living with heart failure, again from Sanford in 2012. And this reviews and breaks it down into 4 easy categories for the patients to focus on when discharged. First is activity, then nutrition, medications, and self-care. So activity is the first category, and for patients with heart failure, it is important to encourage activity, however balancing it with rest periods to ensure no overexertion. And for my patient specifically, I encouraged him to find time to elevate his feet as he's a trucker, and this would be crucial but maybe difficult. The second category is nutrition. For patients with heart failure, it is important to review a low sodium diet and food restrictions. According to Sun, Lee, and Song in 2011, heart failure patients who follow a low sodium diet of less than 2.76 grams per day and a food restriction of less than 1 liter per day had a lower incidence of cardiac hospitalization and death. This was a new concept for him, and so I tried to break it down for him. First, I encouraged him to not add any table salt to his food, as 1 teaspoon of salt has about 2,300 milligrams of sodium, and this would be about his allotted daily sodium for the day. Second, I broke down into 4 easy categories for him to stay away from. First being vegetable juices such as V8 juice, tomato juice. Second would be processed meats such as ham, bacon, sausage, bologna, hot dog. And then third was canned vegetables and canned soup. And then the last category was processed or prepackaged foods, which included frozen TV dinners, frozen pizzas, snack foods such as popcorn, pretzels, chips, crackers, that sort of thing. And then the boxed foods such as boxed macaroni and cheese, ramen noodles, rice-a-roni, pasta-roni, and hamburger helper. And I gave him a number of 300 milligrams of sodium per serving to focus on, and did review nutrition labels so he could follow that for that pre-processed packaged foods. The third category is medications. For this patient, he had never been on any medications previously, and so this was, again, a new concept for him. I needed to ensure not only that he understood his medications, but that he had means to pay for them upon discharge. So we did review this at length. As noted previously, he does not have insurance. I also provided him with a pill planner. Due to his traveling and being on the road frequently, I thought that might be a useful aid for him. And due to the possibility of changes of his medications while he was for this hospital stay, I reviewed his current medications, but also got a pharmacy consult to review his medications just prior to discharge. And the last section on this sheet is self-care. I reviewed daily weight monitoring and the importance of consistency and timing. I also provided him and educated him on a weight log and provided him with a digital scale to ensure compliance. According to Veroff et al., in 2012, daily weight monitoring is essential because dramatic changes in body weight are indicative of fluid balance issues. I also encouraged him to keep any follow-up appointments he has, to monitor for symptoms and keeping a status of swelling in his legs, feet, and tummy. And the last section, or the last point in that section that we reviewed, was his smoking cessation. I reviewed smoking cessation with him, and then I also asked him if he thought he was ready to quit. He thought he was, but he needed more information, and so I did put a referral in for the smoking cessation program, as they would be able to provide more education for him and support upon follow-up. The back section then is our zones. We have a red, yellow, and a green zone. The green means he's doing great. The yellow zone is kind of a caution zone, and the red zone is an alert zone. And then there are two columns in each section. The first is what the patient is experiencing, and the second is what they should do if they're in that section. So in the green zone, he would be experiencing things such as no weight gain, no chest pain, no swelling, no shortness of breath. And then what should he do if he's in that zone? He should continue taking his medications, continue his weight monitoring, continue his low sodium diet and fluid restrictions, and keep any appointments we have scheduled for him. If he is in the yellow zone, he would be experiencing things like weight gain of 2 pounds from one day to the next, or 3 to 5 pounds in a week. He might be increased shortness of breath or swelling. He might have a cough with green or yellow or even pink frothy sputum, and he might have increased dizziness. What was he educated to do if he was in that zone? I provided him with my phone number as the transition coordinator, instructed him to reach me. I also provided him with a generic phone number to contact whatever provider was on call. If he was in the red zone, he would be experiencing things like weight gain of 6 pounds or more, dizziness to the point of fainting, shortness of breath that is unrelieved with rest, swelling that's difficult to get his boots on, or chest pain. And what he was educated to do if he was in that zone was to either present to the ER, the walk-in clinic, or his primary provider. I have the unique situation that I follow up with my patients as the transition coordinator. I know that this teaching session was a success due to my follow-up phone calls. He has quit smoking. He has dropped an additional 7 pounds since discharge, and upon follow-up phone calls, he has referenced his green, yellow, and red sheet, and so I know he is referencing his own teaching tool at home. In summary, my patient had the potential to be a very difficult patient to instill lifestyle modifications. I was successful due to the fact that I kept the terminology simple and easy for him to understand. Heart failure diagnosis is often overwhelming, and keeping education simple is important. I also broke things down for him into easy categories for him to remember. And lastly, I was able to follow up with him weekly via phone calls to ensure compliance. This is great when available, as patients are often stressed and overwhelmed. It may not catch even half of what the content that was reviewed during education sessions. This follow-up allows reinforcement of content that may have been missed. Thank you so much for viewing my health teaching plan, and I hope you enjoyed it. Here are my references.